I've got a lot of people that are executives that I work with now that they want to go there. They want to see how they can have a holistic life, right? Wealth is part of it, and these things that we do, but what is it all for, right? If we don't have health, we don't have wealth. And if we have wealth and we don't, it's just...
That's why I've got this show,
yeah,
because
man,
everything is
That's why I'm
wealth
here.
and health, because it doesn't matter how much wealth you have. If your health is not in good standing, you can't buy it.
Can't. You can never buy it back. You're either pay now or pay later. That's the idea.
Yeah.
You know who made it.
Welcome back to the Wealth Eazy Show, where we talk all things wealth, health, and real estate. And today we're talking health with my guest, Dr. Ruminder Birk. Dr. Birk is an accomplished chiropractor, an author, and a DJ. He attended the famous Life Chiropractor College in San Francisco, where he was the recipient of the prestigious and coveted Clinician Award of Outstanding Service. Please welcome to the show, Dr. Ruminder Birk. Welcome.
Thanks, Johnny. It's a pleasure to be here. Honestly,
Thank you so much for being here and for coming. Give the listeners a 2-minute bio on yourself.
I mean, I've been practicing chiropractic for 24 years now, so time flies when you're having fun. But it's been a journey, I'd call it, right? It's a health journey. I think it incorporates all aspects of my life. Being a chiropractor is all-encompassing, but it also adds so many new avenues to explore, and that's kind of why I'm here with you today. It's just always a new challenge is always welcome in my life. Yeah.
I understand your inspiration to become a chiropractor came from a car accident. Tell us about that.
Yeah, I mean, a lot of people get to chiropractic through this kind of story, right? I mean, you're either injured as an athlete, as a armchair athlete, or sitting at home, you get injured sitting at your job. So for me, it was a car accident that started this whole journey. I was a student in university. I would go with my friend's mother to watch her get adjusted. She was going for migraines, and I was like, wow, that looks intense, and it's not really for me. But I was interested, right? I was in the field of science and kind of exploring my options as a university student. You never know what you're going to end up doing. And we literally got, it hit me. It literally struck me from behind one day on the way to school. A truck slammed into us, woke up with excruciating neck pain. And I thought, hey, let's give this chiropractic thing a try and see if it can help me. And it did. And it was amazing. I mean, I had been exploring physiotherapy and other therapies at that time, but I felt the results and I was like, I want to do this for others. I feel like this is something that I could really get myself into. And it's been 24 years or more.
But you're not just in chiropractic. I mean, I've read your bio and you've done like over 200 clinical studies on other things just outside of chiropractic. Tell us about that and how that incorporates with the whole chiropractic medicine.
Well, like I said, this has opened me up to the whole world of wellness, right? So chiropractic, it's a choice to stay in that one lane, or you can really take yourself for your own sake first. I find this is more for me, and then I say, hey, this is really working for me, just like chiropractic did. And then I take it to my patients, right? I want to help others, but I want to do what works, right? So these courses were all leading me different paths that I was exploring, and then I've kind of fine-tuned my methods by doing that, right? So when you get into it and you say, hey, this nutritional part works, and I find this helps me sleep better, this gives me more energy, this is giving me longevity, it's all part of the puzzle, right? It's kind of putting things together on your own and then taking it to the people that you serve.
See, most people think about chiropractic, I've got to go to chiropractic because I have neck pain or I have back pain. Mm-hmm. But it's not just about pain. Let's talk about overall health. Like, what do adjustments do for, let's say, your immune system, for example?
Yeah, I mean, this is the idea that I want to get people to learn. Like, when they come into my practice, they're coming in like I did. I went in with pain, but then it's like, give them what they want and then educate them on what they could have, right? So I think that's the best way to start the process, is learn through something that motivates you enough to go and find out, right? So when I go into what I deal with the nervous system and explaining the benefits of it beyond just pain, I'll briefly state it, is that, it's your nervous system that we're really treating as chiropractors. We're not treating your back pain or your neck pain. We're treating what's inside that area, which is your nerves. So as your nervous system controls everything in your body, it's the master system in your body. So what do? We take care of our cars. We take care of our teeth. We go and get our teeth cleaned. We take care of brushing our teeth daily, but we don't take care of our spine and nervous system, which is our master system. So what I'm trying to get at is that this is the most important thing to take care of because it controls everything in our body. Our nervous system controls our mood, our immune system, as you were saying. You know, there's studies that I'll get into that talk about the immune system, but our digestion, you name it, right? So what would be the master system would be the one that we want to take care of most, in my opinion. But, you know, I think we have it the other way around in these days where people take care of how they look and how they, you know, whatever else they want to do. But by taking care of our nervous system, we're really going to get the best results in all aspects of our lives. So briefly, that's the idea.
So how would an adjustment, because obviously, I mean, you're my chiropractor, you're my son's chiropractor, right, and I've been seeing you for years and getting neck adjustments. How does say a neck adjustment help with the nervous system or the immune system?
Yeah, I mean, it is the nervous system that we're getting at, like I said. So our adjustments, especially in the neck, right? So in our bodies, we have two nervous systems that run everything. So we have the system that's called the autonomic nervous system. It does everything on autopilot. We don't tell our liver to do things. We don't tell our stomach to do things. We don't tell our heart what to do. But, you know, basically that's what we're looking at when we get to our nervous system, controlling these things. How can we help it work at its best? So in the spine, we start with stress, right? So stresses are there for everybody, whether it's mental stress, physical stress, chemical stresses that we place on our bodies. They end up leading to areas in our spine getting locked up, or we call that subluxation. So misalignments in our spine are going to be affecting every function in our body. So in our neck especially, we have the top and bottom of our spine. We call that our parasympathetic nervous system. So that's the nervous system that helps us rest, relax, digest. And then we have our mid-spine, which is our sympathetic. So I think you might have heard of fight or flight, right? When we get stressed out. That nervous system is what causes us to run from tigers, or in these days, you know, internet or whatever, you know, arguments we get into in our daily lives. But what we want to reestablish is that nervous system balance, right? So as an adjustment that occurs in the top and bottom, especially in our neck, that is going to help balance that nervous system. Our parasympathetic nervous system can come into balance with our sympathetic nervous system, creating health, right? So when our nervous system is functioning at its optimum, then our body can deal with these stresses better instead of letting it get to us.
Is there any correlation between our organs and the spine?
Yeah, basically, as I hinted at there, an example would be a study that was done called the Windsor study. So there was a great study done in the 60s. This guy was in the University of Pennsylvania trying to dispute chiropractic. So he was actually doing this study to like dispel chiropractors and saying that the chiropractors who say, well, I'm seeing people get better with liver disease or heart disease or immune function is improving. Why is that happening? Or if it's happening, if it's not happening, he wanted to prove it wasn't happening. So what they did was they took about 150 cadavers, known causes of death, so people that had died from heart disease or liver failure, as I mentioned, they go to the spine and take dissections of these areas. And they found in every case, 100% correlation where that part of the spine had diseased, degenerated, and had dysfunction, linking back to the exact area that would be nerve supply to that organ. So I thought that was a really cool example of how we can kind of show that this is true, that the nervous system controls everything. And if it's not functioning in our spine and our nervous system, then that organ is going to be affected. So whether it's your immune system or other organs. So that's really, really cool. I think that opened the doors for other studies, and that obviously now we have more and more advanced studies that show the benefits of chiropractic can vary across the board, really.
So are you saying that adjustments can contribute to preventing some things like liver disease, kidney disease, and things like that to our organs?
Yeah, I wouldn't ever say I treat any of these organs, right? Because that's really not a chiropractor's place to say that I treat a liver or I treat a heart. But, what I want to say is that it makes sense, right? Like if you think about this logically, when we have pain in our arm or our shoulder and we go to a chiropractor and the neck adjustment helps that, we look at that as the same way that a prevention in the organs could occur if we get adjustments and optimize our health, right? So we eat well, we drink water, we stretch and work out and all these things for reasons, because if we do the good things for our body can function at its optimum and have the least amount of stress. So possibly, yes, we could say that, but in the general concept of it is to me, it made sense for me. And that's why I share that story with others.
What role would nutrition and healthy lifestyle, these factors, what role would that play in supporting the effectiveness of a chiropractic adjustment for both short and long term?
I mean, that's everything, right? When we talk about it, chiropractic is one part of that puzzle, right? So when we talk about it, when I talk about it with my patients and I say to you, there's the 3 types of stress: mental, chemical, and physical, right? So when we're looking at how can we minimize those, chiropractic is going to establish the foundation of it through nervous system care. But we have to do the other things. We have to take care of how we eat. We have to put in the reduce the chemical stresses by putting in good food, good vitamins and supplements that are going to enhance our chemical body. Because we're exposed to toxins in our environment every day, pollutions in our food, our quality of food has degraded over the years. So we need to enhance that chemical aspect and reduce those other effects. Then we look at this in a physical, right? So we're looking at the physical posture, how we sit on these phones these days. You know, you tell your son all the time, like, sit up straight and whatever else. We got to tell these kids that they don't listen. But, you know, we know that's not good for them, right? We know that that's causing postural problems, not just about how they look. Now we can understand that it affects their nervous system and their health. So do we want our children to do better than us? Always, right? So what can we do? We can remind them of that, help them through posture and posture exercises and stretches and putting them in activities that enhance that. So martial arts or whatever else we do that enhances their spine health. And the emotional stuff is obviously part of it, right? When we get into decreasing our stress, deep breathing exercise, whatever else we do, each of these things is going to add to what our weight, our load is of stress in our body, right? Look at it as like a backpack. You put a backpack on your back and you're putting rocks in it, or you're taking those rocks out. Are you going to feel heavier or lighter? So that's kind of how health works. And that's what, you know, that's how I take it.
Hey everyone, it's John. I just wanted to thank you for being here, and I would ask that you please subscribe to the show by just clicking the subscribe button right here. I'd really appreciate it. It helps grow the show so we can get even more successful guests on the program to help you. If you're already subscribed, a huge thank you. When you subscribe, you're going to get access to the program before anybody else does. So if you would, just click subscribe right here. Thanks so much, and welcome back to the Wealth Easy Show. I catch myself, and I see my son and my wife and everybody around me. They got their phone, and their heads are down. What is there a long-term effect of, you know, constantly having our head down and on our phone, or what should we be doing? Should we have our phones up, like?
Yeah, you know it. And so, you know what you're saying. You just answered your question, but yeah, you know, and this is not even a long term. Like now I see kids, you know, 24 years ago in practice, they didn't have these devices as much as we do now. And now I see x-rays. I take x-rays in kids and teenagers just to see where their spine is developing. And if there's any long-term concerns, it's happening earlier and earlier, right? If you see the postures, you see them on their phones all day long, what are they growing as, right? Like this is as the twig is bent, so grows the tree, right? Where are they now? What's going to happen when they lock this in permanently? And it's not just about how it looks, like I'm saying, it's about their nervous system. So if their nervous system and their head forward, we call this forward head posture, it's flexed, it's stressed, what's that doing to their health? Like we're not even going to know what that does until like 20 years out from now. And then, yeah, there needs to be an awareness, right? And we know it. We've been always told sit up straight, but now we've got like way more reason to say that because these phones are accelerating everything. And it's phone to the face, not lift it up and don't bring your face to the phone. That's kind of what
I try that. And I try to keep my phone. My arms get tired.
Well, you know, it's good for your arms. You go to the gym, right? So I think you should look at it as a workout.
Maybe rest it against something so that my head's not completely down.
And we can get stands. I mean, if you know you're going to be on that thing for long, but I mean, I know it's unavoidable these days, but I think we can do better.
You talked about stress. Let's talk about that topic because everybody carries stress. I mean, sometimes, you know, I find, you know, I make my traps, like even today, like my traps are sore. And sometimes you think, oh, I might have had a workout. I'm thinking, no, I didn't work out in the last couple of days. But then I come and see you and you go, oh, you've got a lot of stress. How does like the stress build up in here? Like where's it caused from?
the three things we talked about, the stress chemically, physically, emotionally, we don't even realize it, right? So this is like that backpack, the rocks in the backpack, you're walking around, you're adding a rock in when you stress out on the highway, you're adding a rock in when you stay up late and you don't get the sleep that you need. So how is everything, right? Like, I mean, we look at it in countless ways and we know it. I think all of us know what's good for us and what isn't. And obviously you can't live a perfect life and that's how it goes, but these are the things that counteract, right? If we can counteract our stresses on a daily basis and know what healthy habits that we can create, it's all about habit. I think that's really what is the most powerful concept in our lives is habit. It's got to be autopilot and it's got to be something that you understand why you're doing it and then implement it in your life on a daily basis. And then it takes away those stresses.
Is there a certain demographic of people that should maybe focus on a routine of seeing a chiropractor on a daily basis, like such as an athlete, a pregnant woman, or even a senior?
I think anybody with a spine.
Okay.
Right?
That's,
so that's
everybody.
Oh, there you go. So yeah. So if you have a spine, you should probably take care of it because now you understand that it's your nervous system that we're talking about and it's your health, right? Like, I mean, what do you say about anybody to exercise? Who should exercise?
Everybody should exercise.
So everybody should brush their teeth, right? It's a choice, right? I mean, everything in life is a choice. You can do healthy things, as I mentioned. And if you want to do that, I mean, there's ways to look at it as far as relief care. We do corrective care in my office. We can get into how you can fix your spine from the stuff that you've had for years. Kids, we can prevent things ahead of time. Seniors, we can help. So many demographics we can talk about. Athletes, obviously, they take care of their bodies and they punish their bodies. So they want to perform better, but they also want to prevent injury and they want to do better at whatever they do. So they're going to benefit from this in countless ways with chiropractic and their nervous system being tuned up. It can make a difference of seconds. I mean, I'm working with upcoming sprinters for Team Canada. So, it's a matter of milliseconds, right? Mm-hmm. So if we can enhance that performance by turning on their nervous system, their reactivity, their acceleration, their muscle strength and balance, obviously it can take off milliseconds, which counts as everything for a runner. But then we talk about anybody who's just playing sports on the weekend. You want to get injured and then be dysfunctional for the rest of your week, or do you want to like take care of your body and then do what you want to do in life, right? It's about function. Yeah, go ahead.
I was going to say, I noticed like after I've played a weekend of golf, I come see you and you say that it's like 1 foot, I think it's my right leg is like an inch shorter.
Right, yeah.
Because my hip, like, how does that happen? How's my leg become shorter because my hip is locked up just through like a weekend of golf?
I mean, you're repetitively rotating on one side, right? Yeah. I mean, if you look at the concept of golf, I mean, it's not really natural to do that countless times in swings that we're doing. Mm-hmm. Or, you sat all day long and then you drove all day long to play golf. Your pelvis has been distorted, right? So when we're talking about alignment, leg balance is always indicating of what the spine is doing. So when I look at that as a checkpoint, that's how I know which side of you're out of balance. I work through your nervous system and that's a whole nother thing. But we go to your pelvis eventually and correct that misalignment because obviously being in alignment when you're golfing is going to be better for your swing. So everything comes down to being in balance and alignment. So it's probably the golf, but it's probably everything else you're doing that. It's keeping it tuned up, prevention.
So, I mean, I walk into your office, my leg is maybe a half inch or an inch shorter, but I don't notice it. Mm-hmm. But then I leave and you've corrected it. If I don't get it corrected, what effect could that possibly have on my spine if I'm walking around with my pelvis being locked and my leg is half inch shorter or shorter than the other one?
Well, we start with the mechanical stuff, right? If you want to start it with how it affects you, obviously being on a bad foundation, right? Yeah. If you're on a bad foundation, you're building a building, we know that's not good for you, right? It's going to have stress points up the spine, whether it affects the lower spine or higher up, it's all going to be out of balance, right? So you want to have a good foundation for everything you do. And if you're out of balance, you're going to create stresses on that part of the nervous system, then affects all the organs in there, as we already talked about, right? So what wouldn't it do up, but it could also affect below, right? So your hip joints, your knees, your feet, it's like a car. If we're out of alignment, which side is going to get wear and tear is the side that you're putting more weight on, right? So, we look at it as in many mechanical ways, nervous system and function, and literally all the way up, right? So all the way up to the neck, it can affect your posture or your health, yeah.
So your specialty is subluxation, right? Now there are some chiropractors and some out there say you shouldn't get adjustments. And then there's guys like that are practicing like subluxation. What are some of the misconceptions of why some chiropractors would say you should try to avoid getting adjustments?
I mean, there's professionals in all fields that are good and bad, right? Like you could call that, you could say it's not the profession, it's the person, right? So really when I look at it for who you're going to, you should obviously screen who you're going to and find someone that does it right, right? So what I do, for example, is, and I have countless chiropractors I work with, we take x-rays of the spine, we take a thorough history, we're gonna look at if it's safe for you, we're gonna look at if it's needed, where it's needed, the technique matters. So if I'm just going in there and just working on everything, like, you know, some of these YouTube videos you're seeing, it's just for the show, right? I'm not doing it that way. I'm doing it specifically to unlock and turn on your nervous system so your body's working in balance. And sometimes people come in and they don't need it that day because we've corrected something and it's worked its way out. So the answer is, I mean, you obviously need to have it done if it's done right and if it's working on a purpose, right? If we have corrections to make, then it's generally healthy for you. If someone comes in and just starts pushing around on you without knowing what they're doing or x-rays or really having a cause, then yeah, of course, anything like that could be not great for you, right? It's like going to a CrossFit workout where the coach is not really correcting your form. Everything can be detrimental, even if it's good for you.
So in my business, financial services, before I sit down and do anything with a client, I do what's called a KYC, know your client. And before I even put anything together for you, I have to understand what is your risk tolerance? What are your objectives? How do you classify risk? There's a whole list of things that I go through. Now, with someone walking into a chiropractic office and they don't do any type of, because I remember when I first came to you, the first thing you did was you sent me to get x-rays. Right. Let's take a look at your neck. Let's take a look at your spine. If someone's not doing that, should they question that office or ask why they're not doing it?
If you're going for a massage, you know, and that's fine, right? If you're going in to get treated and you want to go for what I'm talking about, it's your nervous system and your spinal health. Yeah, obviously, you know, nobody comes to you and just says, well, I don't really want to talk about this and like have you look into what I'm doing financially. You know, they're obviously not your type of client, right? You're just like, make me money, right? But that's not the kind of person you are. And you want to work with people for their lifestyle. You want to enhance their lives. So I call that life effect, actually. So in my office, my goal is to sit down with the patient, figure out their history, figure out what got them there, what they've tried that hasn't worked, but then get to like goal setting in their life effect. That what is it that you're really here for? Like people coming in to like lift their kids up again. They want to like keep up with their friends and whatever it is, golf and things like that. So the life effect that it's taking away from them, we want to give that back. That's why my book is called Back to Life. It's really giving them back to what they want, the life effect that they want. So I think it depends on what your goals are, right? If you're looking to be someone that just comes in for a massage or a feel good, you know, once or twice, I'm not that kind of doctor. I'm not going to treat you that way, but you can find somebody down the street that would do that. But if you're looking to do things properly, correctively, long-term, as they are financially with you, I think that's the type of person that I want to work with, right?
You talked about kids and you treat my son. What reason would kids have? I mean, we know why my son comes and see you. My son, over the years, he's developed a motorized tic, right? And we have found that since treating him with his adjustments, they've become less.
Right.
And I guess going back to the whole nervous system.
Yeah.
The nervous system sometimes is causing some of these. What other reasons would a child have for you to treat doing adjustments? And at what age can they start at?
So again, if they have a spine, they need to be seen, right? So we talk about birth being a traumatic experience for a baby as well, right? So as a child would go through the birth process, whether it's a C-section or a regular birth, there's going to be strains placed on that first newborn baby that could set the path for the rest of its life, right? So we're talking about the health of that child immediately from birth, and the effects that have initially could be fussiness, latching like breastfeeding, problems with digestion, they call it colic. those things can be easily checked on very gently, obviously, right? We're not talking about how I work on you, I would work on a newborn, but it's literally, I say the checking with the pressure I put to check a tomato, right? Like you press on it, and that's all I do for the adjustment. It's literally that much, but I got to find the right area. Obviously, that's what comes down to the technique. But the benefits are you release that nervous system immediately at birth, and then that just lets the baby grow into a healthy start. So I always recommend right at birth. I recommend every step of the way as the baby's learning how to sit, the baby's learning how to crawl, the baby's learning how to walk. You know, there's checkpoints, falls and tumbles, obviously. And then as they get into sports, hockey or whatever else, they get slammed into boards and stuff. You know, there's countless reasons physically that can happen. And with your son, it's the same, right? He's very active, and these phones and everything else we talked about. It's all about prevention and enhancing the health of our child before we get into adult years, where there's going to be longer implications that are harder to correct at that point, right? So it's always a choice. How far you want to take this and when do you want to start? But I've been adjusting my son since birth, and he gets adjusted regularly. Yeah.
You know, it's amazing because I never really thought about that, but you've got a baby who's curled up in a womb in a ball for 9 months.
It can start there, right? So we're positioning in the womb is before the birth. And then we're literally pulling a baby out, and doctors, you know, we've seen cases of like breaking clavicles as they're pulling the baby with so much force, or just the gentle process is still very difficult on the baby's neck. So of course that can create early onset subluxation. Yeah.
So your recommendation is you have a child, go see someone who's experienced in subluxation, and just do a very, very gentle.
Yeah, so I'm a member of the ICPA, the Pediatric Chiropractic Association. I went through their certification. So basically, those are the chiropractors that have the training. So if you're looking for a baby, I would go on the ICPA4kids.org, I believe it is. Go on the site, find a practitioner there that you would know that has that training.
With the pandemic, it sent a lot of people working remotely from home.
Yeah.
These people are constantly sitting all day, spending hours in front of a computer. Are there any techniques besides seeing someone like yourself? Is there any techniques that people that are sitting in front of a computer all day should be doing maybe at home without, like, prior to coming in and see you?
Yeah, I mean, not sitting, right? So I have a stand desk, right? So that's an option. Yeah. So, and we're looking at sitting as the new smoking, right? So, you know, definitely it's not great for us, right? We weren't meant to sit in chairs, and the way we sit in chairs, so even if it is a chair, you know, a lot of times people are working on their couch, they're working on the dining table. It's horrendous what I'm hearing, right? And pandemic didn't go away as far as working from home. So that's ongoing, right? So yes, you could have a desk that rises and lowers, and you can sit at times, but stand at times. I think that's the ideal situation for people working from home. But if you can't, then you can get a riser you can place on your desk as well, right? So if you have a regular desk, you can throw that on, put the computer on there. Ergonomics matter, right? Because this is the stuff you're doing for 8 hours, 10 hours a day. And that's the things that we talked about, habits, right? If you create the healthy habits in your environment, in your home, that's really what it is 90% of the time. It's not the big stuff, it's the little stuff that adds up. Yeah.
Is there really a benefit to having a stand-up? Because if you're standing up and you're on your feet constantly all day, I remember my early 20s, I used to do security at nightclubs, and I'd be standing for 5-6 hours. Man, my feet were killing me at the end of the day.
Yeah, I mean, your feet, right? But yeah, I mean, what's more important, your spine or your feet? But you can do both, right? You can sit at times. You can, you know, when you're working from home, you're not standing at a door at a club at this point. Those days are behind you, I'm assuming.
Oh, yes.
Okay. And,
more than 25 years now.
Okay, good. But, you know, that's
bartending too.
Yeah, exactly,
on my feet all day.
Exactly. So, you know, obviously there's a time and place for it, but you can mitigate and reduce those effects by doing these things. I mean, paying attention to your posture. I mean, I have back supports that I give some patients when they're sitting for long periods. You can put that on. It's not a dependency if you're using it as a tool, right? So that, and then you go off your desk and go and do the other stuff, right? We do yoga, we do stretching, we can do the adjustments and everything else that you need to do. So you can reduce that effect, but it's obviously part of life.
One of the services that you offer, and I spent a fair amount of time doing, is spinal decompression. Talk to my listeners about what that is and who that may benefit.
So yeah, again, over the years of my practice, you know, modifying and continuing to refine what I do, for me, it's become a niche practice now where we really specialize in decompression. So the technology is a computerized table that we use for disc, spine, sciatica problems, neck pain, arm pain, numbness, tingling. What we're finding is the chiropractic enhanced with decompression. So decompression is computerized tables. So you belt it in, whether it's your lower back and spine. If it's in your neck, it's a harness that you rest your neck in. And then it's a sequence table that has a program of pulls and relaxations that pull that spine. And so I correct the subluxations. So we're resetting that area, but now we'll be able to pull apart the disc that's damaged over years of life, right? So whether it's sitting and injuries from sports or whatever else, we find that the cartilage and the disc gets better faster, and the results are much more long-term. The studies have shown that with decompression. It's a corrective treatment, non-surgical, that prevents surgeries, corrects these problems at the cause. So we're not getting into things that are more dangerous with surgeries and permanent problem damage, nerve damage.
I noticed over my 37 years of weight training and bodybuilding.
Football. I think
Football.
you play football, yeah.
I used to be 5'11". I'm 5'10" now.
Yeah, that's your discs, yeah, and your spine and your posture and decay, right? So we call that, flexion and decay, right? So as we get into nursery homes, older postures that are just, people just shrink. But if you can think about between each vertebrae, we have these cushions, and if they're not their height, you're going to lose height too, right? So you got to take care of these things because it's literally a degenerative process over time, gravity, and life, right?
So in my condition, heavy squats. So constantly putting that bar on your back, and for anyone who's out there who also trains and lifts heavy, over time, that basically has compressed my discs. So is that what's made me shorter? Is just
I think, yeah, it's a combination of that and everything else you do. Definitely compressing your spine with a heavy load and then and letting that pressure the disc, it can enhance that. I think most of it is from what we talked about, sitting too much, and then the posture and everything else. It compresses. A lot of people are just sitting in this poor posture as the discs take the load. They're just losing height and fluid, right? So the workouts are, how long do you really do that for? It's 20 minutes at the most for squats, right? So that's not the cause. But if you're at a point where it's already compressed and bulging, let's call it, that could be the final straw, right? So it's always, everybody's chronically getting to that point. I never really find anybody that's like suddenly that happened, unless you have a slam on your tailbone and you fell off stairs or something, right? It's usually these repetitive problems.
So over time, as 50, I'll be 53. So a spinal decompression table will actually, it's not going to make me taller, but it's going to bring some of that, but it's going to take some of the relief off, like my discs.
Yeah, I mean, people are reporting, people are telling me I'm looking taller. I mean, you're looking taller because you're standing straighter, right? So yeah, I mean, you can...
Posture's better.
Posture's better, right? So your disc is getting bigger, whether that's millimeters bigger or not. You're upright, your posture is straightened out, your neck is over your ear is over your shoulder, and your shoulder's over your hip better, so you stand straighter. Of course, that can make a difference in height and appearance, but it's about health and function.
What advice would you give to someone considering going to a chiropractor for the first time?
Well, as I said, you want to find a good doctor that's either recommended by somebody who's going to one, or you research, and these days it's easy to find, right? You go on Google and you check the reviews and you see their process, right? If you got enough reviews, they're telling the story and they're sharing their experience and the results. I think this word of mouth in this day is easy to find. So, I mean, that's kind of how I would start. You can always go to the ICA, which is the International Chiropractic Association. I'm a member of them because they really are practitioners that are chiropractic, true philosophically. That's the process of finding somebody there on their portal. So if you're looking for that, that could be a nice way for anybody anywhere in North America or over the world. It's International Chiropractic Association.
So you don't just have to be in pain to go see a chiropractor, just even preventative. So what would you recommend for an adjustment, like once a week?
It's a choice, right? Like we talked about, if you're looking to go to somebody that's correcting your spine, that's going to take a little bit of work in the beginning, and it's based off your history and your x-rays and your story, right? So it can get to maintenance. So if you're looking to correct, you go through a process, whether it's once a week, 2 times a week, 3 times a week, what you need and whether you need decompression or not. As I mentioned, I use those tools to enhance the severe cases. After that, if the doctor's doing it right, there's going to be an x-ray checkpoint to check in and see your progress with corrective care to decide on maintenance, right? So I will get into once a week, but personally, I even recommend once every 2 weeks for patients for adjustments only. So if you're coming in once or twice a month, it's pretty easy to manage that for 5 or 10 minutes if you're going to a chiropractor who's done the process with you. So maintenance is easier than getting back into crisis again. So it's a choice, right? So again, how often you do it, it's based on individual lifestyle. How often you go to the gym, how much stress you have, how much you sit, if you're traveling a lot, if you have other chronic injuries. So it can get down to as little as once a month, but every 2 weeks is kind of where we see the research shows people get the best results and don't backtrack by doing it that way.
I notice I see you more in the summertime during my golf season.
Yeah. Well, you have a lot of goals when it comes to golf, and also, you know, the damage that golf does to you. So yeah, the reasons are there, right? It's a choice, right? It's a matter of, I want to play better and I want to play without hurting, and I'm hurting after. I have lots of reasons that you come in during the summer. Yeah, for sure. Yeah.
You wrote a book called Back to Life. Tell us, what would people learn by reading this book, and what was your inspiration to writing it?
So my inspiration was really that there is so much information out there on health, right? It's very complicated. And then we've got the two sides of the coin. You've got the medical approach and people looking at taking medications, and then there's the approach of all holistic. And so I want to kind of meet in the middle where I can show people the simplest way that I've found health can be achieved. So, it's not detailed in the way that becomes overwhelming, right? So I want to get into making it simplified in a process that I use, the tools that I use in my practice or I use for myself, as I mentioned earlier. These are the things that I found have the best health benefit for me. So whether it starts with chiropractic, benefits for children, as we've talked on, pregnancy, any age, athletes, and then I get into nutrition a bit as far as vitamins and supplements. I'm a big fan of using biohacking as far as different variety of tools. So I have whole body vibration is explained in there. Stretching and all sorts of things that can really give you the tools that are simple day-to-day lifestyle choices you can make. So we call it Back to Life, getting your health back, getting your life back while you get your health back is a combination of health, pain relief, but then beyond that, right? Getting into wellness. Yeah.
I notice also in your practice, you have a vibration plate.
Right.
Tell us, why would you have a vibration plate in a chiropractic service? What does that do for someone?
Countless things. So, the vibration has been one of the best tools that I've added personally that I brought to the practice, right? So vibration, whole body vibration, it was developed initially for NASA astronauts that came back from space. When they've been out of gravity, they lose bone density, they lose muscle tone, and they were finding that a specific vibration, 30 hertz vibration, it enhances the recovery. So it increased muscle strength, bone density, and circulation for these astronauts. And then it eventually came out to the general public, right? So really the benefits in my practice are countless: bone density, stabilization of the spine. We find that the patients that get adjusted and go on there, it's putting input into the brain and through the nervous system by the vibration going into the body. We're getting enhanced chiropractic results. And in general, just muscles relaxing, muscle tone, rebalancing of the nervous system. Countless sorenesses go away, like for lactic acid from our workouts that enhances the lymphatic drainage. So our lymphatic system is our secondary circulation system, as you may know. So we have blood flow that pumps by the heart, but lymphatics have to happen through movement. So vibration helps that lymphatic drainage occur much better than it does on its own. So that and just, the benefits are countless. You feel like you're just light as air coming off of that. So we have our patients go on there 5 minutes after every adjustment, so they're just getting that benefit as they leave the office. Vibration I use in countless ways. I have vibration hand tools that I focus the vibration on areas that are hurting, whether it's the shoulder or knee. I have foam rollers that I definitely recommend to patients that have vibration built in, because everything shuts off better in the muscles when you're on a vibrating, whether it's through the platform or on the foam roller. You just get deeper muscle relaxation. It's a shut off of the nervous system.
Interesting.
Where it's too tight. Yeah.
With the, I'm seeing a lot of new reports regarding blue light therapy and red light therapy. Does any of that contribute to overall health with the immune system, whatnot? Would you bring something like that into your practice?
So I have laser therapy and I've used light therapies over the years. So that's actually a great question. I mean, blue light therapy, I would call blue light detrimental for us because blue light's in our screens, right? So
Okay.
blue light and the effects of on our sleep is the problem, right? So when we're exposed to these screens, especially later on in night, the blue light is basically triggering our brain to stay awake. So if we're trying to fall asleep at night, being exposed to this blue light is really not great for us. So we have night mode on our phones. You can turn off the blue light. You can wear glasses that should, reduce the blue light exposure later on in the day. Using red lights in your home, these lights can help actually get your brain to produce more melatonin. So red light is the opposite side of that, right? So we're looking at it as a tool. I use red light panels that I have actually at home that I use. So I get those for patients who are very interested in this concept. But red light, infrared light, and then yellow light are the healthy ones. So the red light is again for helping just relaxation wise and helping our muscles and body relax. Infrared is deeper. You don't see it, but it's a type of light that goes into the tissues and penetrates deeper. So that wavelength is going to get deeper into muscles and reduce inflammation. And then yellow is more for superficial because it's a lighter, the density or the light penetration is less. So you're getting into like skin healing and other superficial things. So all three lights can be in a panel. That I have one that I use. And otherwise you can definitely use light to enhance your environment for sleep and other things like that. So
Interesting.
Yeah,
I noticed because my wife has a medical spa, and every time she does a hydrofacial, she puts you under a red light.
yeah, these masks are becoming more and more popular on Instagram and whatnot. So celebrities are wearing these masks that are for their skin inflammation. Yeah, so definitely for that purpose. And then you can get a panel you stand in front of.
I've
so
seen
your
those.
whole body gets it. And I use that every
Gary
morning.
Brecka's really big. I don't know if you know who he is. Gary
No,
Brecka's really big on having, I think they're called like a gravity pad, just like
So there's grounding mats.
grounding mats
yeah.
and red light panels.
Right,
So
you can do that at the same time. You can put bed sheets that ground. So basically, the panels, there's a couple brands out there, and they're all great as long as they're in the certain wavelengths, and we can talk about that. But it's a triple panel that I stand in front of every morning. Right, starts my day with the red, infrared, and yellow all at
Every
once.
day?
Every day, yeah.
And for how long?
15 minutes. Get the day going, and then if you got the vibration plate, you can stand on your vibe, have the panel there. There's so many ways you can play with like layering your biohacking in the morning and start your day, right?
But what does it do? Like, what do you feel? So when you're standing in front of this red light panel, what are you getting from it, like to start your day? Because what starts my day is a good cup of coffee.
Right. So both, right? I definitely have my coffee. I use bulletproof coffee where it's like my fats, my MCTs, everything.
Yeah.
That's part of my regimen. But the light panel is penetrating and actually turning on mitochondria. So in our cells, the powerhouse of the cells, the mitochondria, and ATP production for energy is through that area of our cell. So these lights go to the mitochondria and actually power them up like a cell, right? We're looking at batteries in our body, and these batteries all charge up, and then we have more energy for our day. So, I guess your listeners are success-based and they want to have the edge and they want to have the energy to do the things that they're trying to accomplish. This would be one of the tools that gives you the energy that you need, right? So it's part of, using natural energy instead of having to caffeinate ourselves. But obviously, I'm a big fan of coffee, yeah. And I use other tools. We get into hyperbaric oxygen chamber I have at home. I mean, I use that. There's a lot of techniques that you can get into, really play with this. I've got a lot of people that are executives that I work with now that they want to go there. They want to see how they can have a holistic life, right? Wealth is part of it and these things that we do, but what is it all for, right? If we don't have health, we don't have wealth. And if we have wealth and we don't, it's just...
That's why I've got this show.
Yeah,
because
man,
everything
I
is
know. That's why I'm
wealth
here.
and
Yeah.
health, because it doesn't matter how much wealth you have. If your health is not in good standing, you can't buy it.
You can never buy it back. You either pay now or pay later. That's the idea.
Yeah.
So, what's the point of it? Yeah. So that's why, these things are not just for a problem, right? I'm not doing these things because I have this back pain or whatever else. I'm looking to be the best I can be for the people that I'm serving in my practice. So I got to be the best I can be physically, mentally, and I think those tools luckily I'm able to use that in my practice. Like whether if you're another type of executive doing other things, you go to work for other things, like you're going to help people get their wealth and their lifestyle established the way they want, but you need to be healthy to do that. So
Absolutely.
it goes to hand in hand. Yeah.
I had a guest on a couple of weeks ago, He's from Dallas, Texas. He lives in Dallas, Texas, but he's got about 75 sun spas. They're called glow tanning. And he said that he has now incorporated red light therapy as part of a spa service, and he's so busy because people are just coming in, lying on these beds, and it's all red light therapy, and he can't keep up with the demand now. And he's like one of the only, it's not even a tanning studio who's added these spa services, and he's busy.
That's what people want. I've been to a place that does the bed. You get inside, you have cryo chambers, you have, red light therapies. So again, you could do it at home. You could go to a facility like his. That's a great idea, because you should do these things. It's not waiting to fall apart. It's about preventative. And that's what people really want. They want the beauty effects with the benefits for health, right? So if you get both, I think that's really what it's all about. It comes from the inside out. So in chiropractic, we say, above, down, inside out. It's really your mental state, and then health comes from within, right? Mm-hmm. How you look on the outside, it matters, but how does that happen if you take care of yourself internally? Then it shows, right? Then it really comes out. Yeah. So, I mean, that's the best of both worlds.
It's like having a car and never getting an oil change. I mean, you get your oil changes for engine preventative maintenance, right? If you're going to drive, 30, 40,000 kilometers without getting an oil change, chances are you're going to have some engine problems, and it's going to cost you a lot of money. So change the oil, take care of yourself, get these adjustments, and prevent the long-term effects of something really bad happening.
Yeah, that's what I said at the beginning here, was that we take better care of our cars or our teeth than we do of ourselves and our nervous systems and our health, right? So I think there's a lot to be learned if we really look at it, not in the day in, day out of what we're trying to achieve in life, but how are we going to get there? What are we going to get? How are we going to be when we arrive there?
Exactly. Right. So you've got your practices in Woodbridge. Tell our listeners where your practice is, how they can find you, and where they can get your book.
Yeah, we're in the heart of Woodbridge, Ontario, and we're at woodbridgechiropractor.ca is the website. Atlantis Chiropractic on Instagram would be a great place for resources. We have videos and other things I'm sharing on their health tips. Back to Life is on Amazon, so you can get that at amazon.ca, or come and see me in the office and we'll talk further. Yeah.
Fantastic. Yeah. Thank you so much for joining us today. I'm really glad to have you on. If you like this episode, please subscribe and share it with your friends. That's all for today. Take care of your wealth and your health.